joining us on this Sunday. Hi, everyone. Thanks for joining us on this beautiful Sunday. I'm going to say beautiful because that's how I want it to feel. Anyways, I'm Dr. Jacqueline Guevara. Here with me today is Mr. Adrian Shepard of Uniting Roots LLC. And today we're kind of just briefly discuss a bit about therapy and coaching, the similarities, the overlaps, the differences. But first and foremost, like I said, this is Mr. Shepard, and disclaimer, he is my husband, but nonetheless, a great coach. So Adrian, tell us a little bit about yourself and Uniting Roots.
Okay. Well, United, you're probably going to see me smile a lot. I'm super excited. I've been wanting to do this with Dr. Guevara for a long time, and I'm honored. So you'll probably see me smile a lot. So Uniting Roots was founded on the idea that people by themselves are creative, resourceful, and capable, achieving whatever they set out to achieve. And so I've always wanted to do coaching. It's always been a part of who I am. And finally working on getting my international certification and, going big.
Awesome. Tell us about the name. Such a unique name.
Oh,
I love
yeah.
it.
So Uniting Roots, right? How that came about. So no two people are alike. And when you look at a forest or you look out in the wilderness, you'll notice trees, right? And no two trees are alike. However, trees all have something in common, and that's roots. And us as people, we have roots as well. So I like to think of roots as being a part of who you are,
Okay.
and
I
it's
like that.
various aspects of who you are. So let's say, like, take me for example. I'm a father. I'm a husband. I'm a worker. I am an artist, a poet, a coach, a video gamer. Yes, um, and I have all these different aspects of my life.
Mm-hmm.
But when you trace them all back, they come into my tree, right? So kind of like how a tree has roots, and the roots keep you grounded.
Mm-hmm.
And what happens when you unite those roots? You could withstand hurricanes, tornadoes, all seasons. And just like trees, we go through seasons in our life where we shed and then we regrow. So that's where United Roots came from.
Love it. Love it. Love it.
Yeah.
So yes, again, one of the reasons we're here today is because both of us actually we get this question a lot, whether it's potential clients, family, friends, colleagues. So as a licensed clinical social worker, what I do is therapy. I do mental health therapy, and then obviously Adrian as a coach. And what kind of coach are you?
So I am working on my niche, but I am a executive coach, a life coach, uh, professional development coach, transition coach, and it sounds like a lot, um, but I don't necessarily think I want to narrow down any more than that. You know, I would like to be there for the people who are in mixed change in their lives,
Mm-hmm.
and I would like to be there for career changes and life changes, and for executives, delivering messages to your employees,
Mm-hmm.
making sure that you're communicating effectively, making sure that you're showing up how you want to show up, and that way you can empower your employees and take your business and everything that comes along with it to the next level, and even help you in your day-to-day life.
Awesome. So yeah, so as I was mentioning, we get a lot of questions about, well, is therapy right for me? Is coaching right for me? Can we do both at the same time? So figured we'd kind of break it down and start with, okay, well, what is therapy? What is coaching? So I can start.
Yeah.
Again, as a licensed clinical social worker, I have my own online mental health private practice where I work with clients on mental health issues. So what is therapy? It's funny because there's not a single concrete answer to that question, because it just depends, right? There's so many disciplines that provide therapy. So, for example, like a licensed clinical social worker or a licensed counseling professional, a clinical psychologist. There's different disciplines within the mental health helping field. So therapy looks different, or at least the definition can be somewhat different. But what it boils down to is therapy is looking to help someone in dealing with emotional and mental health disorders. So when we're talking about these kinds of disorders, we're talking about things like post-traumatic stress disorder, major depressive disorder, generalized anxiety disorder, obsessive compulsive disorder. So we're using our clinical skills to basically diagnose, to treat, and eventually prevent from these disorders coming back or creating even more chaos in someone's life. There's also different frameworks that are used by different professionals. I could throw out about 80 million of them, but some of the most commons are like cognitive behavioral therapy, or trauma-focused cognitive behavioral therapy, dialectical behavioral therapy. So there's all these like fancy schmancy terms and training that we as licensed professionals get to deal with these different kinds of disorders. And then, of course, it also depends from state to state because, depending on the discipline, depending on the amount of hours you have to get for licensure and all these regulations you have to follow through the health boards. But again, what it boils down to is we're talking about helping with mental health disorders, kind of like the ones that I mentioned, and alleviating those symptoms that brought you to therapy in the first place. So as far as coaching,
she's so smart. She's so smart. Don't let it downplay. Wow. Let me look at my notes. No, I just want to give you guys the ICF definition. So ICF is the international accreditation for coaching, and they're kind of what's consolidating the coaching community on an international basis and setting precedents. So I just want to make sure I give you that tidbit here. So it's partnering with clients in a thought-provoking and creative process that inspires them to maximize their personal and professional potential. And now I'm going to give you the Uniting Your Roots definition of coaching. So coaching is an interactive, creative journey between you and myself. And it's a partnership. And the whole purpose behind it is for you to go on a creative journey and, come to realizations that you wouldn't be able to come to by yourself. And that's why it's a partnership in the beginning. And it's that. I mean, it's you having a conversation with yourself. It's a guided conversation, an engaged conversation with fully devoted attention, and a champion that wants to see you get where you want to go. That's basically coaching in a nutshell.
I like that because when you mention partnership, so within the mental health helping professional role, you'll hear people always mention a therapeutic alliance. So when you're looking for like a mental health professional to work with, it is critical to have a therapeutic alliance. And it sounds pretty similar to what a partnership is.
Yeah.
Having that trust, being willing and able to work with each other, instead of just one person directing the other person, to do something or act upon. And something else I wanted to mention as far as mental health treatment, I always tell my clients that when they work with me, they're on a healing journey, right? Because we're talking about stuff from the past. We're talking about emotions. We're talking about, maybe trauma, maybe stuff that, you don't exactly, want to face all the time, but it invokes such heavy emotions and like heavy behaviors. And sometimes people realize that they're happening and other times it doesn't. So for me, I consider therapy to be a healing journey because, again, we're navigating. We're trying to understand where these emotions came from, why they are how they are, certain behaviors, like why you're, enacting certain behaviors. And then again, just healing from past trauma, healing from, past hurt. And so is there anything like that within the coaching world?
So the first part, yes, right? So as far as partnerships, we do something called it's called co-creating a relationship, right? Mm-hmm. And so in co-creating a relationship, that's where you build that trust. That's where you set precedents. That's what you set what coaching is, what coaching isn't. That's where you define what coaching is and what therapy is, and then also what mentorship is. Yeah. So there's 3 caveats that kind of feed into that, but it's all to build that trust that you were talking about, right? And now as far as coaching goes, not necessarily concerned about where you came from. It's important, but it got you to where you are today. And coaching is to get you through today into tomorrow in the best light that you want to be in. So we will go a little bit back in the past, and we will, talk about self-limiting beliefs and, kind of get an idea. But the purpose behind that is to bring them up in the conversation so that we can be aware that we have these kind of things. We have inner critics. We have self-limiting beliefs. We have a guide, right? A guide that helps us navigate day to day. And it's just kind of to presence them. And then it's to go forward. And that's the creativeness part, right? So you are capable of doing these things. What is that goal you want to do? Why is it important to you? And then there is some parts where you go deeper, right? So you may ask questions that kind of provoke thought. Mm-hmm. And it's not necessarily to be therapy, but that thought is what you need to get over whatever that obstacle is or whatever that hump is.
So would you say coaching is future oriented, present oriented, or a little bit of both?
I think you do a little bit of everything, right? So there's a part of coaching called presence coaching, and presence coaching is moments, right? And it's pretty intense. So it's because you're deep in thought and you're seriously asking yourself, is this what I want? How can I get there? And then you do like envision, in 5 years from now, what would that look like, right? What would you like it to look like, right? So you do get deep, but there's a difference between therapy. Coaching can feel like therapy because it feels good to talk to yourself. It feels good to listen to yourself. It feels good to have somebody championing you, and it feels good to have somebody asking you questions that you don't think to ask yourself, mm-hmm. right? But it's not therapy.
Gotcha.
And it's not that it's future oriented. It's that it's kind of like a road or a journey uphill, right? Mm-hmm. And when you're going uphill, sometimes you need to take breaks. And sometimes you go up to come down to go back up. And so I think in that aspect maybe is how I would view it.
Okay. And see, and that kind of brings something else up for me. As mental health professionals, one of the things that we're looking at, right, when we're diagnosing or looking at what symptoms brought the client into our office or virtual office, again, we talk about psychopathology. We talk about symptoms. So whether it's, panic attacks or anxiety attacks or, being triggered by this, that, and the other, which then causes, increased depression or increased, something else. And so a lot of times within therapy, what we're doing is we're helping them understand mm-hmm. their symptoms and then learn therapeutic tools to then manage those symptoms. Mm-hmm. And then after all is said and done, the client has now learned, okay, well, this is a trigger for me. This is what happens when that trigger occurs. This is the symptom I may be dealing with, and this is how I effectively manage the symptom. So would you say in coaching, is there anything like symptoms or anything that you look at regarding that?
No.
Okay.
I would say after you meet with your therapist and then you come see your coach, those tools will help you, I think, help you get yourself to the next level with coaching, right? So if you've uncovered something during a session that maybe is not able to be coached, or maybe we've hit something and there's a trauma, or maybe there's a trigger, or maybe there's something that just comes up and comes up and comes up. And if it's something that you need therapy on that coaching can't handle, right? Then you go work with your therapist, and then it removes that block, and then you come back to your coach. And so they can go side by side. Yeah. Now there are things that we look for, which is just limiting beliefs. And you look for limiting beliefs, you look for bias, you look for what is telling you that you cannot be great. What is telling you that you cannot achieve that goal? What is telling you? And you just, it's more of a curiosity than it is a push. And every session is driven by the client and not the coach, right? So I think that's maybe a little difference too.
Yeah, so that's interesting because I think, and again, my mental health professionals out there, usually when we start with clients, we're the chatterboxes. We're the ones asking all the questions, like not so much leading the session, but we're exploring. We're asking questions. We're trying to get, to the nitty gritty of things. And as clients progress in treatment, it starts to switch where it usually is, for lack of a better term, like the therapist is top heavy, right? And then when we're in the middle, it's kind of 50-50. And then towards the end, the client's the one usually doing most, if not all, the talking, while the therapist is, guiding or, pointing certain things out. But I think what you brought up was important, that you can do both at the same time. You can have a therapist, absolutely. And you can have a coach.
Absolutely. I think it's beneficial now, because I think coaching can help you in a lot of areas, but coaching can't help you with something that requires therapy. And it's important for coaches to recognize that, and there are some things that are coachable. If it's not present in the moment, and if the coach can discern that that's not what's actually keeping you from doing that, and they're more curious about this other aspect of something that you're saying, and they don't go down that path, then maybe you can accomplish that goal without having to go to therapy, right? But there's always going to be something there that maybe will come up again. And until that is done, maybe it'll apprehend you from doing another goal or another accomplishment. If you're an executive, maybe that's why the message that you're sending out isn't being received well by your employees. And maybe that's why you have a hard time talking about it, because there's some underlying issue that can't be championed. So I would say that it's important that if you recognize that you have something, no matter what it is, if it's personal to you, and there's something that's just lingering there and lingering there and lingering there, that you seek professional help, professional mental help. Yeah.
So I guess the other thing that comes to mind for me too, between therapy and coaching, is the length of sessions. So, I mean, just in thinking about, different clients that I've had throughout my lifetime as a licensed clinical social worker, I've had clients that have been with me for like a month or two and they're good, right? But I've also had clients that they've had so much trauma so much substance use, so much this, that, and the other, fill in the blank, that they've been with me for months. And like, you know, I have had clients that have been with me for over a year because, again, there's so much to work through. And so in coaching sessions, like, what are the sessions like? What's the length of it?
Oh, so you have your initial discovery session.
Okay.
The discovery session is a chance to determine why you're a good candidate for coaching, right?
Okay.
And you know, it's a partnership. That's really when the partnership kind of begins. You know, you're just playing like, hey, this is what I got going on, and I say, hey, this is what I can do to help. And then, you know, we kind of just lay it out, and we make sure that coaching is the right avenue for you.
And see, for us, that's clinicians, that's an intake session. So, or like our initial evaluation assessment.
Okay. So once you do that, then you have the fun, right? So you have 30-minute sessions and you have 60-minute sessions. And what people may need to realize about coaching is you may not hit resolution in your first session. You may not hit resolution in your first 6 sessions. It is a journey. Literally, it's a journey that you go on. And it is so impactful to all areas of your life, though. So as long as you stay committed and as long as you're on that journey, you know, coaching can go on as long as you continue to want to grow. Right? So there is no termination date. There is no I'm good, you know. Mm-hmm. There is I'm sorry, that's wrong. There is a I'm good. So whenever you are good, yes, you can stop your sessions, but like, you know, there's always going to be that hunger and there's always going to be that drive, and that will keep you present. And the one thing I will say though about coaching too is that, you know, in order for something to be coached, and I wanted to say this earlier and I apologize, but in order to be coached, you have to have a topic, right? And that topic has to be something that is unresolved, it's personal to you, and something that you're going to be open to talking about and discussing. And that's all discussed in the beginning of every session. And so as long as you have something, you know, kind of going on, and even if you feel like you don't have something going on, there may be something I can point out. Just maybe you change your character a little bit. Maybe you said, oh, I'm doing okay. And usually you say, I had a great day. You know, so there's different things that you pick up. So, yeah, I mean, coaching, I love it. It's awesome.
Can you tell?
Yeah, it's awesome. And I will say I have a coach as well. And, you know, and that's one of the things that really unlocked this passion of mine is going to coaching.
That's awesome. So you kind of touched on a little bit, and I think in this area too, there's similarities and there's differences. So for mental health professionals, when our clients are experiencing success, right? Success in the therapeutic intervention looks like a client having an improved mood, less symptomology, right? So maybe not as many panic attacks or not as many incidents of having, you know, really bad anxiety, just really understanding, being able to identify whatever emotion it is they've been struggling with and knowing how to manage it successfully, right? More times than none. So that's sort of how we know, or in other words, like they've met their therapeutic goal. Like what brought them to therapy in the first place is no longer a huge issue. So how would you determine success within the coaching setting?
I don't. So the client gets to determine what success looks like to them, right? So literally everything in coaching is about the client, you know, and is if the client feels like they're successful, then my job as a partner in that invested relationship is to feel that they are successful as well, right? And so if people are creative, resourceful, and capable, they already are successful, right? So it's just, for me, I don't measure your success. You measure your own success, and I'm just there to be a passenger in the vehicle that's taking you on your journey.
Awesome. All right. Well, that was a really quick, just, little tidbits here and there of what therapy and coaching is. Is there anything else that you wanted to add about coaching or even Uniting Roots?
Hey, so please check us out, www.unitedrootsllc.com. Check us our social media, Facebook, Instagram. Whenever you catch the live, it'll have the links on there. Really excited to be starting this business off. Really excited to be pursuing this international certification. What's next is just unlimited possibilities. And if I can have an impact on any one person, I will be satisfied as a coach. And I just love to see people experience joy that they brought upon themselves. There's no better feeling in this world than when you help somebody help themselves. And I honestly, it's the most rewarding feeling. And coaching is so fulfilling to me in life. There's not many things that bring me this much joy other than being married to this wonderful woman.
Good answer. Anywho, well, thank you guys for joining us. If you have any questions, please feel free to reach out to myself or Adrian Shepard, who is accepting new clients right now, right?
Yes, I'm currently accepting new clients. We'll be launching a program here soon, if you don't mind if I talk about that.
All right.
All right, so we'll be doing two things here soon and shortly. Be launching a program. It's a values program. And the takeaway is that you do an exercise, a value exercise, and it's how are your values aligned in your life. So we discover we do a discovery call, make sure we're going to be good to work with each other, and then we do a values exercise and we lay out what your values are, and then we have 2 coaching sessions on your values and where they are in your life and where you would like them to be. All right, so that's one of the programs we'll be launching here soon. The other thing we'll be doing is a challenge. Yeah, so we're gonna create a challenge. It's gonna be called the Name It Challenge, and it's for people who sometimes have self-doubts that creep up, right? So sometimes we'll say, I don't think I can do this, or I can't do this, or I don't know how to pronounce this word. And what you do when you say those things is, your brain is constantly moving, right? And then what happens is you go, I can't, and your brain goes, okay, and it stops, right? So that thing that you can't do just stopped you because you let it by saying I can't. And so there's nothing wrong with your brain or whatever cueing you to have that reaction, but you can also train that reaction. And so there's a challenge that I'm gonna put out, and it's gonna be name it. So every time that you say something like I can't, or every time you say that I can't pronounce this, or I won't, or wow, this is hard, right? Write down that thing that was hard. Write down that word that you can't say. And the next time, and become conscious of it, right? And when you're conscious of it, the next time, instead of saying I can't, just try it. Just try it. And then later on that night, write it down again, and write it down again, and write it down again until you can, you will, and you won't stop.
That sounds
right.
So awesome.
Look out for that. That'll be a cool challenge, and I mean, hoping to see a huge impact on that. And that to me is just motivation. Just being able to help people with just little things that are big things for people, and just putting a scale to them, and taking your power back.
Love it. Well, thank you so much for sharing all of that. And again, thank you to you all for joining us. And yeah, any questions, feel free to reach out to either one of us. And we hope you have a good rest of your Sunday. All right, take care.